everyone. Today I'm going to inform you about study drug use among students, what we can do about it, and why this would be effective. We're going to begin by defining study drugs. Study drugs are prescription pills students take to increase levels of concentration to cram for an exam. Examples of study drug medications are ADHD medications such as Ritalin and Adderall. There are many reasons that you should avoid using study drugs. They are illegal, they are dangerous, and it is unfair to use study drugs. It's not legal to take these drugs in this way. If you don't have ADHD, you shouldn't be using these drugs to study. Also, many students sell their pills, which is also illegal. It's dangerous. There's many health side effects to using study drugs, and it's also unfair. Some students don't take study drugs to study, and so they aren't getting the same benefits that people who are using study drugs do. Some common side effects of taking study drugs are irregular heartbeat, increased blood pressure, restlessness, anxiety, nervousness, paranoia, headache, dizziness, insomnia, suppressed appetite, diarrhea, constipation, hallucinations, impulsive behavior, and irritability. Now that's a lot of problems just to study for an exam with drugs. And I got these sources from University of Texas at Austin. Also, study drugs are very addictive. They are classified as a Schedule II drug, which according to the U.S. law, Schedule II drugs have the highest abuse potential and dependence profile of all the drugs that have medical utility. Also, using study drugs is considered cheating. It's unfair and unethical. According to Sarah D. Sparks from Education Week, using study drugs is similar to athletes using steroids to get an unfair competitive advantage. Also, it's illegal. You're using someone else's medication, which is illegal, and medication is not meant for this purpose. Now that we've discussed why you shouldn't do study drugs, is there a solution to the problem? We're going to talk about what colleges can do. Colleges can inform students of the dangers. Many probably don't know why they're bad, so informing them will help. And also, they should have classes teaching students how to study properly without using study drugs. They should also make sure there's consequences if students get caught using study drugs. If they have consequences, then they'll be less likely to do it. Also, colleges should perform random drug testing so that students will be less likely to take the drugs because they don't want to get caught with them. Why will this work? This will work because students will understand taking study drugs is dangerous, illegal, and cheating. And students will be more hesitant because of consequences and drug tests. To conclude, study drug use has risen over the years and is becoming a prevalent issue on college campuses. Colleges recognize there is a problem with study drug use on campuses, and they have the means to do something about it. College students everywhere are using study drugs. Studies show that 1 in 5 students use study drugs to help them cram for an exam. As future college students and caring members of society, we must make sure that this problem does not go unsolved. Thank you for your attention.